Welcome everybody. It's Marco Vujicic here from the ADA's Health Policy Institute. And I guess first thing I want to say is for those of you joining us from various parts of the US being hit by Ida, we're thinking of you. Stay safe. And if you are joining, thank you for joining under difficult circumstances. So the plan for today is to walk you through a new report that we are releasing from the Health Policy Institute today. It's exciting. It's a first look at robust data on how the pandemic has impacted dentist earnings through the end of 2020. So we have basically like an annual snapshot. And before that, we're going to get to a little bit of just the most recent COVID economic recovery data as well. As usual, in terms of logistics and ground rules, we will be taking questions towards the end of today's webinar. You'll see a Q&A box as part of the Zoom panel. Please use that and only that for submitting your questions and comments. We'll have plenty of time. If you're having logistic issues, I can't hear, I can't see, when is the recording being available? We ask you use the chat box for that. We have a very capable team in the background, so if you get confused, no problem, we'll answer your question either way, but it just helps us if the content questions about the research are delivered through the Q&A box. And I know still after, a year and a half of Zoom, I get caught up with the wrong stuff too, but hopefully we're all getting better at it. So thanks for your patience. The other thing, as usual, we're going to record this webinar and make it available. The report is already up. I'll tell you how to access it in a second. The PowerPoint and the recording of today's webinar will be available in a day or so, and we will let you know when that's the case. So let me get into it. I'm going to turn my video back off here. And as we move into the content, for those of you that don't know, I'm Marco Vujicic. I'm a PhD economist. I'm the chief economist at the ADA, and I head up the Health Policy Institute, which is a wonderful team of researchers and analysts and policy experts. If you don't know our group, we focus really on three things. One is rigorous research. This is the backbone of what we do in terms of having the most reliable data and evidence and putting this out there for the world in scholarly publications, journal articles, infographics, and in today's case, our own in-house publication stream, Research Brief. We do this really to help inform policy, both at the federal and state level, and to really inject impartial research and rigorous data and analysis into the various debates. So there's a lot going on in dentistry in the last year and in the last 3-4 weeks with the whole Medicare debate. So a lot of our data is referenced in a lot of these discussions, which is awesome. A lot of invitations to present to policymakers, give testimony at various forums. And what's great is when the media are writing about dentistry and they need data and research, it's awesome that we are among the main folks nationally that they can rely on. Big area is more for the private sector. And this is an area we've grown the last 2-3 years. It's really delivering insights for your business. So we regularly engage with corporate boards for presentations and thought leadership. We do custom research and consultancy reports for different stakeholders and companies in the dental care space. If you're interested in hearing more about that, that's also available on ada.org/HPI, or frankly, just reach out to us at hpi@ada.org. As I mentioned, two focuses today of what we want to talk about. I did want to take the chance, since we have a captive audience, to give you our latest on what we found in terms of patient volume and different issues that we are collecting monthly now related to the COVID recovery. And then, as I mentioned, the real focus is going to be on the release of this new report looking at basically the 2020 impact on dentist net income from the pandemic. So once again, if you're just joining us, please use the Q&A box for any questions you have throughout the presentation. We will be recording this and making the PowerPoint recording available. The report is already up at ada.org/HPI. I'll tell you that again in a second. So that's been released today. So let's get into the first part in terms of what we're learning about the latest data on COVID recovery. So as many of you know, we've been collecting data at 2-week intervals during the pandemic, and now we moved it to monthly. But here are the latest data from mid-August, and the chart is graphing, hopefully many of you have seen this already and are familiar with it, data on patient volume expressed as a percent of pre-pandemic levels. So again, we reached the new high water mark in our latest polling in mid-August. Patient volume is at its highest level since we've been tracking this, almost at 90% of pre-COVID levels. For those of you that know the weeds about this, we actually changed our response options in the last round to basically allow for more than 100% of pre-COVID levels for those practices that are having their best months ever, etc. It didn't really change much of the trend line, so that gave us some comfort. But a lot of you have asked us about this, so you can enter whatever number you want in our last round. You could be at 125% of typical levels, but the average you see there is at 89%. Interestingly, in the public health sector, FQHCs, public health clinics, etc., we're starting to see now a catch-up, and things are kind of evened out. As you see, there's been a long-standing gap in terms of patients coming back, the extent to which that's happening in the private practices versus public health settings. So that's encouraging news on the public health side. A big thing that's emerging in the data is this issue of recruitment challenges, and I'll show you that slide in a sec. We've really been trying to dig into this. So the first thing we wanted to show you was just the extent of hiring that's happening. So on this graph, you're seeing in mid-August the results on this question: have you recently or are you currently recruiting any of the following positions in your practice? And the orange bars to the right of each little subsection are the most recent data. So for example, almost a third of practices are recruiting a hygienist, slightly more an assistant. If you go all the way to the end, 27% are recruiting administrative staff. So there's a serious, I would call, hiring spree or intentions to hire, a recruitment drive, and you know, particularly hygienists and assistants. And then we asked those that are recruiting or have recently recruited, how challenging has this been? And this is the kind of really startling data. The report, the percentage that are saying it's extremely or very challenging, which are kind of the top two boxes, it's kind of off the charts. So a third of practices roughly are in the market for hiring a hygienist. 90% of those are saying it's extremely or very challenging to fill those positions. And if you go across the board, these are number one, high numbers. And number two, the orange bars are the tallest of any other, meaning that the hiring challenges are getting worse. So we definitely hear this a lot anecdotally from dentists, you know, out in the proverbial real, well, the literal real world. And the data really back this up. Now, I don't want to go into details. We've done a whole release of what's behind this through our regular COVID presentations. But in a nutshell, we've also partnered with ADHA to try to get a little bit more granular in terms of what the hygienists are saying are issues with kind of returning to work. We do know that there still are about 5% of dental hygienists who were working pre-COVID that have still not come back to work. So that number was really, really high, and we've seen kind of a trickling back of hygienists each month we've done that survey, but still, there's 5% that haven't returned to work, that were working pre-COVID. Now, the bulk of that is later career stage, older hygienists. About 2/3 indicate they're voluntarily not going back. It's not that they can't find a job. And among those reasons that are driving that voluntary, I guess, unemployment or underemployment, is concerns generally around COVID in the economy. I'm waiting for COVID to subside. There is a share that indicate safety of their workplace in terms of the measures that practices are taking. And then childcare was much bigger of an issue. It's starting to fall down the list. But basically, these data are coming together indicating that we may have had an early retirement bump that is somewhat permanent due to COVID. Now, for dentists, we have not seen that, at least through our latest data through the end of May, I believe. We have not seen any sort of increased retirement rates among dentists in the older age categories, but it looks like for hygienists we have, and that's definitely translating into some shortages and hiring challenges for practices. Now, I think what's most interesting is this chart, and thanks to the team for thinking of this. We wanted to ask, well, what's the impact? And particularly, we wanted to ask, look, if patient volumes are roughly 90% of pre-COVID levels, we wanted to know what's limiting you from going higher in your practice. And you see here, the top reason given on the far left is staffing shortages, trouble filling vacancies. Number two is the safety protocols that are in place that are kind of limiting how many patients you can see, or I don't know, certain maybe procedures. This is not our expertise in terms of the clinical side, but certainly it's showing up. And then number three is there are not enough patients actually calling me to make appointments. So I think what's really nice is we have some clear insights here, right? Like patient volume looks like it's still going up, right? But it's trickling up. And when we look at why it's not going up more, definitely the staffing shortages are coming through. And when we look at these data here, we definitely see that the hiring challenges are pretty pronounced. And again, with our partnership with the ADHA, we're able to look at what factors are keeping that 5% of the hygiene workforce still out of the workforce. And I told you about those. Now, all this hopefully is useful to different stakeholders to think about, well, what can be done? But at least, again, what I told you is we're happy that we can provide some insights on that. So that's it in terms of your brief COVID recovery update. Now let's get into the heart of the matter for today. So we are launching a new report. It's called How Did the COVID-19 Pandemic Affect Dentist Earnings? We will get into answering that. I just want to make sure you can go download this now or after the webinar. The report now is at ada.org/HPI, and we are launching this today. Without further ado, I want to jump into kind of the highlights. So here are our key findings. For general practitioners, we found that net income was down 17.9% on average when we compare 2020 to the previous year, 2019. Okay, so just over a 1/6 decline in net income. And we're calling this due to the pandemic. Okay, so we know the pandemic started at a certain time and we're still going on, but you're going to hear me referring due to the COVID pandemic, at least through the end of 2020. The bite or the negative impact on dentist net incomes is 17.9% reduction. We go into details in the report about specialist dentists, and you'll see in a sec, male, female, and age, etc. But we did see specialist dentists having a smaller decline in net income. You'll see that in a sec, as well as hours worked. Number three, I think, is maybe the most interesting finding because it's frankly resonates outside of dentistry as well. We did see that female dentists had a much, much bigger decrease in both income and hours worked than their male colleagues. And again, this to me is another data point showing that the pandemic has really affected kind of people's professional lives and job situations very differently by gender. And our data show dentistry is no exception there. I'm going to be very brief on the methods. This is based on an annual survey that our team does on a representative sample of dentists nationally. Look, you can go into the methods and see what exactly we define as net income. Frankly, for the trends I'm going to show you, it's not that relevant. We're defining it the same way every year. And then we do a various weighting and rebalancing, etc. I don't want to go into all this. You can see the methods in detail in the report. Frankly, we have experts on staff that are stats folks and do this stuff for a living. So we are very comfortable with the representativeness of these results. So first chart I'm going to show you is trends for average net income. Of course, these are adjusted for inflation. The green line is GP dentists. And again, these data are national. And the burgundy line is specialist dentists. So again, as I mentioned, there's been a 17.9% decline in average net income for GP dentists between 2019 and 2020. For specialist dentists, it was a much smaller decline, 6.9%. Here are the data by gender on the left and by age on the right. This again is for general practitioner dentists. So far left, there's that 17.9% average decrease in net income in 2020 compared to 2019, the year before. But when we say there are gender differences, this is what we mean. For female GP dentists, we saw a 27% decline in net income on average. And for male GP dentists, it was 15%. So, significantly larger chunk taken out of female dentist net incomes than male. And again, we kind of know what's behind that, and we'll get to the actual hours work data in a sec. And then you also see by age, you see that older dentists on average also had a much bigger decline in net income than younger dentists, right? So for younger dentists, they had the smallest, like a 10% decline in net income in 2020 compared to 2019. And for older dentists, those 65 and older, it was much larger. I know you're all asking, well, what's driving this? We'll get to that in a sec. Before that, I do see things in the chat in the Q&A. Excellent, keep it coming. My team will be going through those. Please use the chat if you can for any technical issues, and use the Q&A box for questions about the research and the report for me that we'll get to later. Hours worked, as you'll see, is a really important driver of these income trends. I'll talk to that in a little bit more, but let's just look at the data. So we're able to also ask dentists, how much did you work? And you'll see we have a lot of details, how much did you work during the period where dentistry was shut down for elective procedures? How much did you work outside of that? And so, our staff crunch all these data. So on an annualized basis, we basically saw a 16.6% decline in hours worked during 2020 compared to 2019. And for specialists, it was 11.7%. So again, interestingly, right, if you look just at these ballpark numbers, right, for GP dentists, we saw a 17.9% decline in income. And hours worked declined by, again, roughly the same amount, 16.6%. So in this report, we really wanted to get the basics out. We don't do, regression analysis to quantify how much of the decline in net income is attributable to hours. But you clearly see that a big chunk is, right? So the income decline is roughly in line, at least for GP dentists, with the hours worked decline. So one could say, and we're comfortable saying, again, directionally, the decline in hours worked seems to explain a lot of the decline in income. Like ideally, we would know per hour of operating your clinic, what's happened to expenses, what's happened to revenue. We have not, the survey's never been designed for that, and it continues to not be designed for that. It's meant to give us some ballpark directional analysis like this in net income, but it's not like a profitability calculator. Has dentistry become less or more profitable per hour post reopening, etc.? All interesting questions, right? What's PPE costs done to the expense side per patient or per hour? Don't do that. If folks are interested in that, we can certainly commission other research. But in terms of this routine survey, it gives us lots of insights, but it doesn't answer every question. Here are those differences in hours worked. Again, this is general practitioner dentists only, by gender on the left half and by age on the right half. So you see here again, right, a much larger decline in hours worked for female GP dentists compared to male GP dentists, and a much larger hours worked decline for older dentists compared to younger dentists. So again, the pattern I showed you for net income, which bars are longest, which are shortest, etc., the directions of these slopes, etc. The hours worked one mimics the net income one very, very closely. Right? You see this gradient by gender and this gradient by age. So I told you earlier, while we have not seen a bump in retirement patterns among older dentists, the data clearly show that on average, they clawed back their hours worked the most. So there was definitely a labor supply effect in terms of older dentists working much less, but they're still working. They didn't kind of retire fully. And then again, by gender, you see a significant difference, right? Much, much, much larger decline in hours worked by female dentists compared to male dentists. Last couple of things, what was really nice here, and shout out to Brad Munson, who's our lead on this survey, in terms of thinking about answering, well, let's look at behavior during the time when practices were open only for emergencies. That's the left half here, i.e. that was kind of the quote unquote shutdown period, compared to when practices were open for elective procedures, which is the right half. So I think for the first time we have here, I think a couple really interesting things. We have an estimate of, okay, how many weeks were practices actually quote unquote shut down? So seeing emergencies only. And it's somewhere, again, roughly around 7 weeks. There's some differences for specialists and general practitioner dentists. That's the first column you're seeing there, the 7.5 weeks for GPs and the 6.8 weeks for specialists. That's basically saying how many weeks in 2020 were you operating on were you open only for emergencies, right? And that roughly corresponds to kind of the CDC and ADA recommendations, which again, we would expect. For the first time, we have an indication of, well, what does it actually mean in terms of how long you're open when you're open only for emergencies? So that 11.2 and 12, right, the second column, that says that during those 7.5 weeks that general practitioners were seeing emergency only cases, they worked on average 11 hours per week, and specialists about 12. Now, I would have thought specialists potentially were much higher in terms of, okay, if you're open and you're a specialist, I would think you're seeing more emergencies, but it's not really showing up here in the data. So during the shutdown period, dentists were working roughly, let's call this 12 hours, right? Roughly 12 hours per week. And then when you go on the right, you see, again, 39, roughly the 40 other weeks in the year that they were open, kind of for all procedures, about 33 hours per week. Anyway, so that's how we get a total of the hours worked that I showed you here. Basically adding all this up and weighting it, which is a great, great insight. And again, thanks, Brad, for thinking about that. Lastly, we have the first look that we're aware of actual dollar amounts received from the government on a representative basis for dentists nationally through the various provider relief programs. Now, we earlier published data showing that about 92% of dentists received some form of relief from the government. The Provider Relief Fund from HHS, the EIDL loans way back early, and most commonly the PPP program. In our survey sample, that's roughly in line, slightly smaller amount, about 86% of our respondents. But again, to us, that's very, very close. But more importantly, among those getting relief, what was the average amount? And you see for general practitioner dentists, it was $91,000 in 2020 on average that they received combined in all these government relief programs. For specialists, it was higher, about 18K higher. They're at about 109,000 on average in terms of what they're getting. And the far right column is I think a useful way to think about what do these numbers really mean. When we look at the relief fund amounts measured as a proportion of what the practices collected from clinical care, that's the rightmost column, right? And you see it's roughly at 15%. Again, I'm visually averaging that across those three numbers. But, you know, this is substantial. So you can think about this as, you know, almost 1/6 or 1/5, 1/7 and 1/6. Let's just say 15%. On average, the government relief programs you could think of as, you know, they accounted for about 15% of your clinical care. So they replaced about 15% of your lost revenue, let's say. And again, ballparking this, right? Let's go way back to that first number. Incomes went down on average about 18%. And here we're showing that the government reliefs accounted for about 15% of your clinical care. So again, it's not fully replacing that, obviously. There is still kind of a bite in that income, but certainly it's important that dentists had access to these funds. And again, this was a huge kind of win and a benefit for our DC team, kind of being really on top of this and making sure dentists were eligible for all these programs, getting the word out, and the fact that such a high share of dentists receive these funds. It helped keep the sector afloat, frankly, during a pretty tumultuous year financially. So that's it. That again, if you're interested in more details from us and potentially doing some custom work, you can find us at hpi@ada.org for those that are listening in the private sector, etc. And for the rest of you, the report's available now. Go ahead and have a look at it. I basically covered all of the tables and charts that are in the report. But again, there's more in there that I didn't cover in terms of the text. So with that, let me turn it over to the team, and let's see kind of where we are in terms of Q&A. Okay, Adriana?
Hi, everyone. Good morning, good afternoon. So let me just get to my notes. Thank you so much for submitting questions during the webinar. If you have any additional questions, please use the Q&A box, especially from this point on. That's the only box that we'll be monitoring. Marco, so there are a few questions about the overall recovery. So let's start with those. Robert asked, will 90% of the pre-pandemic level of patient volume be the new normal given the additional preparations required due to the pandemic?
I would say, and the shortage of staff that seems to be quite prevalent now, right? So let's actually, it's a great question. So I would say in the short term, there may not be much more upside. And here's why, right? So trouble filling vacant staff positions, that's reason number one, limiting volume. So unless we think that's going to change in the next short term, right? We would think we're kind of maxed out, The only other factor I see that might change in the short term is the second one, not enough patients trying to make appointments. Now, in separate polling we've done on the public seems very comfortable going to the dentist. There's about 97% of the patient base that says they have no issues, no safety concerns. There's about 3% that still are hesitating, right? So at least for some practices, we may see more upside if there's more patient demand. But again, I don't think there's much there. And obviously the protocols are not going away. So when I look at kind of the reasons dentists are saying that volume is limited, to me, none of these are really going to change much in the next at least 3 months, let's say, right? So I would say, yeah, in the short term, I expect us to hover out at probably around 90% or low 90s, let's say, right? Now, 6 months a year, that's different. So it depends on what the person meant by in the short term or the new normal. I certainly don't see that as a long-term new normal, 2 to 5 years. But in the next 3 to 6 months, I think so. But we'll be the first to know. So join us when we have the September data. Let's see if this prediction is on there.
All right. Kenneth asked, can you explain why recovery among public dental providers has lagged behind recovery among private dental providers? And his second question is, do you have pre-pandemic baselines for hiring slide?
Okay, we don't. On the second one, we don't. In terms of typically what percent of dentists are hiring in like a non-pandemic year. Correct me if I'm wrong, but I don't think we asked that ever. So no. And on the first one, repeat the first one, Adriana.
Can you explain why recovery among public versus private?
Yeah. Mm-hmm. So a few things. On the provider side, at least early in the pandemic, when we were still, well, you all and dentists were adjusting to kind of the new protocols. Just the nature of public facilities are different, right? They're larger spaces. It's chairs in open, large clinics. And the insights we got were that the protocols that were put in place actually limited what can be done in those types of physical settings much more than in private practices that had single operatories and things like that, right? I think what's more interesting and probably a bigger driver is what's happening on the patient side. So we know the patient base that visits private practices is systematically different than the patient base that relies on FQHCs by race, by income. And we had, certainly through at least the early stages of the pandemic, right, we had a major difference in how COVID was affecting Black and brown populations versus white in the country. So we know that in terms of essential care and primary care, non-white Americans were hit hardest in terms of, not going back and being hesitant to go back to clinical care. And dentistry is no different there. So I would say it's definitely because the vulnerable population base is the core bread and butter of FQHCs and public health clinics. And that population was much more hesitant and skittish about their risks for COVID and being willing to go back to clinical settings. Now, I think thankfully those last few data points show like a closing of that gap. So I don't know, hopefully we've gone past that, at least for now. So good question.
All right. Roma asked, still on the overall recovery, is dentist unemployment still under 1%?
Was that stuff that we were reporting in terms of which percent? Oh, yeah, yes. So it's less than 1%. Yeah, I get the 99% that have reopened and gone back. Yes, it remains that way. We have not seen an exit of dentists at all.
Okay, now I'm going to jump to more dentist earnings related questions. And if we have time, I can go back to the overall recovery if any more questions come in. So first, there's a clarification question about the data that are included in this analysis. So Keiko asks, for this income data, are all dentists business owners or are employee dentists included?
Maybe Brad answer that one. This is from
Yeah.
owners, right?
The survey was sent to owners and non-owners, and all the results reported are from that combination of owners and non-owners.
So it is a mix. Yeah.
Yeah.
By the way, let me introduce Brad Munson, the brains behind this operation here with this earnings data. Brad, lovely that the folks can see you. You do such amazing work with us.
Thanks.
So thanks for chiming in. Stay on. Just stay on. Let's
Sure.
keep your video on. Okay, next one.
All right, one moment. Now, a few questions about hours worked. Mary Beth asks, did you evaluate hours worked as whether the dentist was employed versus non-employed or versus self-employed?
Yeah. And the specific numbers on hours per year, that's the question, right? Hours per year?
Yes.
The specific numbers on hours per year grouped by owner dentists versus non-owner dentists, those numbers will be released in our Excel spreadsheet of results. And that spreadsheet should be out shortly, I believe.
Yeah, it's already out. So if anybody goes to ada.org/HPI, you see a yellow alert box that calls to the newest dentist earnings data and all the related documentations, the full brief, slides, this data table that Brad referred to, it will all be posted on that, as well as the recording when that becomes available, likely next week because of the holiday.
Okay, well, I've got the breakdown on hours per year, the relative drops from owner dentists versus non-owner dentists. For all dentists combined, that is general practitioners plus specialists, among owner dentists, the drop in hours worked was 16%. And for non-owner dentists, the drop was 14%.
So not a huge difference. Okay. All
right.
Nicole,
thank you both for the reminder. Let's repeat this again, right? So I didn't mention this. So in addition to the report, there's actually a release of the data. So not the micro data, but as Brad said, there's more tables. There's stuff that's not in the report, like Brad just mentioned, differences by owners versus non-owners. Like that's not in the report, but that's available in the data downloaded. So thank you both for raising that. But Brad, just to clarify, like this chart here, this is inclusive of owners and non-owners. This is combined, right? In terms of like the general data that we put in the report.
Yeah, that slide is a combined responses from owners and non-owners.
Right, good.
Another quick clarification question about the data. Nicole asked, related to last hours worked, does the data include or exclude weeks the practice was shut down?
The way we phrase the question. Could you repeat that, Adriana?
Related?
It's inclusive for the whole year.
Mm-hmm.
I can answer that one.
Yeah.
So this one here, right? As I mentioned, we asked dentists their hours worked during the period where they were restricted, and then outside of that, and then we combined all that. So what you're seeing, like in this chart, is for the whole year, inclusive of that.
Right.
Okay.
So one more question about hours. Jeff asks, can you elaborate on the correlation in hours worked and the decline in patient visits?
So the patient visits that I've been talking about through our COVID polling, and how does that correlate with hours worked? This is good. I don't know. We should look at this, right? So the unfortunate thing is we don't have a month-by-month snapshot of hours worked by dentists, right? As Brad was saying, we asked them about 2020 as a whole. So we don't have an equivalent week-by-week look, right? So in fact, we won't be able to do that. We just have, again, the patient volume, you're seeing it week by week and month by month. This is a 2020 snapshot for the whole year combined. So we actually can't do that correlation. That would have been fun, right? Like we're dentists coming back and working kind of faster than the patient volume was catching up, right? Or the reverse, I don't know. Actually, we can't answer that. It's a good question, but we won't be able to actually answer it.
Okay, I'm jumping to a couple questions regarding the impact on female dentists per se. So Thomas and an anonymous attendee sent a question about the income of females and childcare. So Thomas asked, is the greater decline in income and hours worked by female dentists primarily due to childcare challenges? And then the other question was, you mentioned childcare being an issue for hygienists. Do we have data on that for dentists as well? Could that answer why female dentists had a steeper decline in hours worked?
Let's start with the last one. So I remember in the early stages of polling, right? Like once we saw that 99% of practices reopened and there wasn't this outflow of like early retirement or people leaving the workforce, we kind of concluded, right? Okay, we don't need to keep asking about why people aren't back to work because they're back to work. What this research is showing us is they may have been back to work, but obviously the impact on labor supply is still there, and it's really different by gender. So I think we maybe missed an opportunity, and I'm talking to our team, right, is to look into this. But Adriana, I don't think we asked female dentists about childcare issues and whether that's affecting their hours in any of our polling.
I don't
want to put you on
recall
the
that
spot,
question.
but okay, you don't recall.
I don't
So we
recall.
don't think we've answered it. Yeah. Now, if you look at all the literature that's been done on kind of how the pandemic has had a different effect by gender, particularly among kind of the, again, not particularly, but both among kind of lower end, lower paying service sector jobs, as well as the professional classes of workers. Again, the childcare issue is a factor that's come up through there. How much it is here, I don't know. And I wouldn't even just say childcare. There's parent care and there's other things, right? But I think what I find really interesting is even if that is the case, like, you know, why? Why does that disproportionately fall on female dentists versus male dentists? And we can have a big debate on that, right? But, you know, even if it is explained by childcare, that's one thing. But you know, is that okay? Are we okay with that, I guess, as a profession or as a society? Again, I'm not answering that question. I'm just saying that's an important question to ask and discuss. Because we certainly have seen professional women careers be disrupted to a much bigger extent than male colleagues.
Okay. There are a few questions or more clarification questions about the relief fund data. So Thomas asked, is the average relief funding presented only for 2020 or first round of PPP and not including the 2021 second round? Does it factor in HHS funding?
I think it would be all sources, including HHS, but for 2020 only.
Okay.
So it wouldn't be what was received in 2021. Brad is nodding as well.
Yeah.
And related, Anne asked, in the 2020 income data, was the PP funds included as income?
On that part, Brad, when we calculate net income in 2020, does the relief fund count?
No. Those are separate questions, and we reported them separately.
Okay.
And then somebody followed up with, am I understanding it correctly that the shortfall in 2020 income when the government relief is considered would be approximately 3%?
And that's a good question. So I don't know, Brad, if we can answer that on the fly, right? So let me put the slide back up here, right? So like these numbers, right? The 17.9% on the left, right?
Yeah.
As I heard from you, that's your net income from clinical care in 2020 compared to 2019 versus
Right.
Okay.
I have the phrasing of the question if you want it for net income, but it's similar
But
to
are
what
we
you
counting the government relief funds as income? That was the question.
No.
I'm asking. No.
No.
Okay. So we also showed that there is this 91K on average, right?
Right.
That is replacing this loss. And then the question becomes, is it reasonable to subtract those numbers, right? There's been a 17.9% decline in your billings, right, from clinical care, yet the government relief funds make up about 15% of your billings. Is it reasonable to say the net effect is 3? I would say no. I don't think we
No.
can make that kind of math.
No, the questionnaire asks for the net income of dentists, which is what dentists are paying themselves or what dentists are
Right.
paid.
Okay.
A separate question is how much is the practice billing?
Yeah. Okay.
That's typically a number that could be 3 or 4 times whatever the dentist is paid.
Got it. Okay, but I like this thing. Whether I don't know, we'll go back and see whether we could come with like a net number. If I count all sources of revenue, including the government, what's been the hit, right? Because in a sense, the government programs are meant to replace. Well, it's complicated. The PPP is meant to go to employees' salaries, right? It's not meant to be general revenue to the practice. It's meant to only cover salaries. So, and rent and some other things. So. Anyway, good question. We don't have that all baked into the report. We'll see maybe if we can come up with something later, but thanks.
Okay,
Great
thank
question.
you. Thank you. So for the next 10 minutes, I'll just read the questions as I see them without categorizing them in similar topics. Nicole had a question that said, what are average hours worked pre-COVID? If post-COVID is 33.2, what do we consider as pre-COVID?
Yeah, I don't know what does that mean. It's like the equivalent of this number, but on a per week basis.
Oh, yeah, on that. If you stay on that table, Marco,
Yes.
the comparable numbers from 2019 were similar for both GPs and specialists. In 2019, the average hours per week was nearly 36.
Okay.
So when you look at this table in the 4th column, which is average hours per week outside of the shutdown, even outside of the shutdown, when they're averaging 33 or 34 hours per week outside of the shutdown, that 33 or 34 is still less than the 36 that they were averaging per week in 2019.
Okay. Thank you for having those data handy.
Sure.
So that's an important conclusion. So the reduction in hours is not simply accounted for by the emergency only period.
Correct.
There is also regular, whatever that means now. There is reduced hours in the regular open for all procedures period.
Right, at least for what they reported for 2020.
Okay. And that would support, and again, I'm just brainstorming here, right? That would support the hypothesis that maybe the protocols or we don't know why the hours worked is less. It could be fewer patients, their demand isn't there. It could be the protocols are limiting how many people I can see. I have to space out patients. But I think it's interesting just to know that the hours worked have not fully recovered to pre-pandemic levels, like on a per week basis. Great. So I think, Brad, this is maybe for our next round, next year when we do this, we can dive into some of these issues. Excellent questions. Yeah.
Right. Allison asked, do you have a breakdown of the specialists who responded to the survey and how the results varied among these specialists?
Specialists were part of the survey, all right, but we had smaller numbers of them respond, which is why we didn't feel we could report them in the detail that we have shown here for GPs.
Right. So we can pool the specialists, but we can't report like pediatric, endo. We don't have enough sample size there.
Yeah, in the Excel download, which has some tables not shown in this webinar, we do report specialist results where we can. We do that every year. But you'll see in the column where we report the number of responding specialists for a statistic, those numbers are pretty low compared to GPs.
Yeah. Okay.
Thanks, Brad. Jumping out of earnings and back to overall impact, Mark asked, what do you think is the leading factor regarding employment issues? What are people not wanting to work again because of close contact? Is there any other reason? Do we learn anything from the hygienist survey?
So as I mentioned, there's three reasons, and these kind of change month to month in terms of ranking where you look at, but they're consistently in the top three, right? One is about COVID in general in the US. So it's not about my workplace. It's kind of like folks that I would say are being cautious and I don't know, maybe have comorbidities, but they don't want to be circulating much in society, right? In settings where you could potentially contract COVID. That's one, and that's nothing to do with dentistry. The second one is, and it relates to workplace concerns. And again, we don't know the specifics, right? Is it mask policy? Is it something with the clinical guidelines or something? I don't know, but it's general. It's a sentiment that says my employer is not doing enough to keep me safe, right? And then the third one is childcare. Right. So I don't think it's useful to say which of those is number one. There isn't a big, like it's those three together that account for the vast majority of why dentists are not returning fully.
Okay. And somewhat related, John asks, do you have any data or evidence showing any spread of COVID from dentists or dental offices?
So spread and transmission, not per se, but together with our Science and Research Institute, we have been publishing on the infection rate of dentists and hygienists. Again, I don't want to go into all that. There's been webinars we've done. There's papers published on that. I mean, the punchline is that, I mean, yes, we have seen some slow rise in prevalence, which we would expect because those numbers only go up, right? The percent that have ever gotten COVID. But the bigger conclusion was that certainly among dentists and even among hygienists, the infection rates were vastly lower than any other healthcare profession we could find data on. I don't know about, are there confirmed cases that the CDC has said were transmitted in dental settings? Honestly, I haven't been up to speed on all that. And how many were. But from the infection tracking that we're doing with our colleagues in the science group in the ADA, again, those are very encouraging results. I mean, these are very low infection rates for professionals, right? For healthcare professionals.
Okay, let's see. I think we have time for a
Maybe
couple
one
more. Yeah.
Maybe one more.
All right. Okay, I'll just read the first one that comes. Okay,
Right.
this may have been addressed earlier, but what predictions do you have on vaccine mandates for dentists, staff, or patients? Do you see offices creating those mandates? And Richard, in a separate question, also asked, are we planning on polling staff on not returning if mandatory vaccination for health workers is in place?
We're going to take all that again into consideration. We have a group that helps guide what questions we ask in our COVID polling of dentists. And I know this issue is obviously hot and has come up. I don't have an answer for that. I won't even get into the whole prediction business on this, honestly. This is a moving target, and every week in the US, things change. Certainly some states I know, including Illinois, where we are, have already mandated that dental team members should be vaccinated. I don't know how many states have done that. And kind of it's not really an area that we're heavily involved in. But we may explore this again, depending on what the information needs are. And thanks for the suggestion. And sorry to not have a response on that, but it is what it is. But we'll look into it.
Maybe just one closing question, Marco. Do you have any predictions on how dentists will fare in 2021 compared to 2020?
Oh, and Brad, chime in too. You too, Adriana. I mean, again, the key things there are what the public is saying about safety of going to the dentist, which to me is very, very favorable, right? We're basically, there's a small sliver of people who used to go to the dentist that are still not back. Very small sliver, right? I don't think, just my opinion, I don't think whatever happens with the next variant or the next outbreak, I don't think we'll go through a period again of kind of closing dentistry for elective care. I think the profession has demonstrated reopening safely, managing the risk, keeping patients and providers really safe. I think it's an amazing track record and something that everybody who's a stakeholder in this field should be proud of, in my view. So I think that's kind of working in dentistry's favor. The big thing in the next few months to year is this issue of staffing shortages. I think if you can't fully staff up, that will limit patient volume, right? And profitability and earnings. But honestly, let's assume we hover around this 90% or above, right? 95% of pre-COVID levels in terms of patient volume. You know, the income is going to recover much more in 2021 than it did in the end of 2020. That's all I can say directionally. Will it surpass? Will it level below? I mean, I don't know. It may not recover fully to pre-COVID levels in 2021. But directionally, I'm comfortable predicting it's going to rise, given all these factors. Anybody else want to add to that? Brad or Adriana?
Oh, just to, well, it may go without saying, but we've been mostly talking at the national level, and the experiences can vary a lot depending on where you live.
Yeah, true. And again, we are limited with our data. So it would have been nice to have this state by state, but we don't. And we won't even try to through these methods. Anyways, thanks everyone for joining. Excellent questions. We have some homework to do. As Brad mentioned, you can get additional data tables, things like by owners, non-owners, these results. Please, the report's out there, public free. Go ahead, use it, distribute it, and you'll see a recording and slideshow in the coming days. And on behalf of the great team, Sylvia's in the background as well. She's not on video, but Brad, Adriana, and myself, thank you all. And again, those in IDA's wake or in the impact zone, we're thinking of you. Stay safe. And until next time, that's it from the Health Policy Institute team. Thank you.